What if one small pill was quietly shrinking your brain, not in years, but just after 3 months of use? Every day, millions of older adults take medications they trust for allergies, anxiety, sleep, and blood pressure. But new research is uncovering a shocking truth that could affect millions. Some of these drugs might be quietly triggering memory issues, confusion, and even dementia long before anyone notices. A recent review revealed that several common medications, often given to seniors, can raise dementia risk by up to 80%. And here's the scary part. Most of these prescriptions are still widely considered safe and are regularly handed out. This video reveals 9 medications tied to cognitive decline, including one linked to the most severe brain shrinkage ever documented in older adults. If you or someone you care about is using any of these, it's critical to understand the risks and know what to ask your doctor before it's too late. Let's start with number 1, opiates. Common examples in this group include oxycodone, OxyContin; hydrocodone, Vicodin; morphine, MS-Contin; fentanyl, Duragesic; codeine. 3 years before her diagnosis, 72-year-old Margaret was prescribed oxycodone after hip surgery. It started as short-term pain relief, but she kept refilling her prescription. Over time, she seemed more confused and forgetful. She once asked why her kitchen floor was moving and couldn't remember how to open her mailbox. Her husband noticed she was more withdrawn and would stop mid-sentence as if lost in thought. 3 years later, a neurologist diagnosed her with early-stage dementia. Studies show long-term opioid use can speed up cognitive decline by as much as 40%. These drugs dull more than just pain, they interfere with brain function. Opioids target the brain's reward and memory systems, and over time, they can damage white matter, which helps different brain areas communicate. This results in slower thinking, dull emotions, and memory trouble. The longer opioids are used, the more the brain adjusts by shutting down critical functions. The result? A slow, quiet breakdown in brain power that can go unnoticed until serious damage is done. Number 2, benzodiazepines. Common examples include diazepam, Valium; lorazepam, Ativan; alprazolam, Xanax; clonazepam, Klonopin; temazepam, Restoril. At age 69, Leonard began having trouble sleeping after losing his wife. His doctor gave him a small dose of lorazepam. It helped initially, but within a few months, he began doing strange things, like storing food wrappers in drawers and taping up the refrigerator to keep the cold in. His daughter thought it was grief, but then he left the stove on all night. 3 years later, Leonard was diagnosed with moderate dementia. Research links benzodiazepines to a 32% to 80% higher risk of memory loss, depending on dose and duration. These medications work by calming the brain, but that sedation also dulls memory, learning, and attention. Prolonged use has been connected to brain shrinkage, disorientation, and paranoia. And yet, doctors still prescribe these medications to seniors, sometimes for years, without fully explaining the potential long-term impact on the brain. Number 3, muscle relaxants. Common examples include cyclobenzaprine, Flexeril; carisoprodol, Soma; methocarbamol, Robaxin; baclofen, Lioresal; tizanidine, Xanaflex. 4 years before her diagnosis, 73-year-old Judith began taking cyclobenzaprine for back spasms. Not long after, her family noticed strange behaviors. She poured orange juice into a teapot, mistook a hallway closet for the bathroom, and once asked if a sock puppet on TV was running for mayor. At first, they laughed off her senior moments, but things got worse. Eventually, Judith was diagnosed with early vascular dementia. A key 2020 study found that seniors using muscle relaxants long-term were 36% more likely to develop dementia. These drugs slow down signals in the brain and spine, which helps ease tight muscles, but also lowers mental alertness. In older adults, this sedative effect hits harder. Over time, it dulls brain activity so much that memory and clear thinking start to erode. Most people think muscle relaxers are harmless for occasional use, but when taken regularly, They can silence key brain circuits needed to stay sharp. Number 4. First-generation antihistamines. Common examples include diphenhydramine Benadryl, Unisom sleep gels, chlorpheniramine Chlortriton, hydroxyzine Vistaril, promethazine Phenergan, cyproheptadine Periactin. 5 years before his dementia diagnosis, 71-year-old Arthur began taking an over-the-counter allergy pill every night to help him sleep. He didn't think twice. It was just a cheap tablet from the drugstore. But within a year, his daughter noticed he was repeating himself constantly. Arthur once left his keys in the freezer, then accused a neighbor of moving them. 2 years later, he got lost driving to his favorite coffee shop just a mile from home. By then, his memory problems were impossible to ignore. He was already showing signs of Alzheimer's. Research shows that using first-generation antihistamines regularly can increase dementia risk by up to 54%. These medications block acetylcholine, a brain chemical essential for memory and learning. For older adults, who already have lower acetylcholine levels, this added suppression can accelerate memory loss and confusion. Despite the risks, these drugs are still sold widely, often marketed as safe sleep aids or allergy fixes. But if an older person is taking them nightly, they may be doing more than just getting drowsy. They might be experiencing the early effects of drug-induced cognitive decline. Number 5. Sleep medications. Common medications in this group include Zolpidem Ambien, Esopiclone Lunesta, Temazepam Restoril, Zalplan Sonata, Doxepin Silenior. At 69, Carol just wanted to sleep through the night. Her doctor prescribed Zolpidem to help with her insomnia. Within a few weeks, her family noticed something odd. She'd wake up disoriented, wandering the house at 3 a.m., even pacing around the basement. A year later, she began confusing names and once tried brushing her hair with a spoon. By 71, Carol was diagnosed with mild cognitive impairment, and her decline hasn't stopped since. A 2019 study in BMJ found that seniors who used sleep meds multiple times per week had a much higher chance of developing dementia. These drugs interrupt slow-wave sleep, which is vital for memory and brain cleanup. Over time, they also distort normal brain wave activity, dulling thinking skills and accelerating brain aging. Even if the medication is stopped, these sleep aids don't just knock you out, they reduce the brain's ability to repair itself, creating the perfect storm for long-term cognitive decline. Can stopping these medications help reverse the damage? For certain medications, especially those causing short-term memory fog like benzodiazepines or sleep aids, stopping them might improve alertness and recall. The brain can bounce back, especially if the issue is caught early. But for others, especially those tied to lasting brain changes, some damage may. Number 6. Statins. Common medications in this category include atorvastatin Lipitor, simvastatin Zocor, rosuvastatin Crestor, pravastatin Pravachol, levastatin Mevacor. 3 years before he was diagnosed, 72-year-old Walter was put on a high-dose statin after a routine cholesterol test. He felt fine at first, but then odd things happened. He poured cereal into a shoebox and said his wife's name. Just didn't sound right. One night, he woke her up at 2 a.m. asking why the walls were melting. Eventually, Walter was diagnosed with early dementia. Some research shows high-dose statins might raise the risk of confusion and memory trouble in older adults. A key 2020 study found long-term users were 58% more likely to have memory issues. Statins reduce coenzyme Q10, a nutrient the brain relies on for energy. Without it, neurons struggle to function. Other researchers say cholesterol is critical for brain structure and memory support. When levels get too low, the brain may lose its ability to form connections, leading to cognitive breakdown. Number 7. Proton pump inhibitors (PPIs). Common medications include omeprazole Prilosec, esomeprazole Nexium, pantoprazole Protonix, lansoprazole Prevacid, rabeprazole Acipex. At 74, Beverly began complaining of a metallic taste, even when eating plain toast. She'd been on omeprazole for years to treat acid reflux. Suddenly, she accused her husband of burning food that was never cooked. Then she stopped eating altogether, saying everything tasted like metal and smelled like old coins. When she mistook the bathroom sink for a trash can, her daughter insisted on a memory test. That's when early dementia was diagnosed, just 3 years after she started the medication. Studies have shown that long-term PPI use is linked to a 44% increase in dementia risk. These meds block vitamin B12 absorption, which is key for brain function. They also disrupt healthy gut bacteria, which affects the brain through the gut-brain connection. PPIs were designed for short-term use, but many seniors take them daily for years. Even worse, they're still commonly recommended for long-term relief, often without fully discussing the risks. Number 8. Antipsychotics. Common medications include risperidone, Risperdal, olanzapine, Zyprexa, quetiapine, Seroquel, haloperidol, Haldol, clozapine, Clozaril. 2 years before his diagnosis, 71-year-old Dennis was given quetiapine for sleep and irritability. But soon after, things changed. He poured maple syrup into his coffee maker, tried using a coat hanger to open the fridge, and once asked why. The mirror man was copying him. His mental fog progressed quickly, and not long after, Dennis was diagnosed with early-stage dementia. Studies confirm that antipsychotics can worsen brain health, especially in seniors. A 2023 review found that long-term use of meds like quetiapine and risperidone led to loss of brain volume in memory-related areas. These drugs block dopamine, a key chemical for focus, memory, and emotional control. In older adults, this disruption can rapidly trigger confusion, forgetfulness, and even delusions. The saddest part? These drugs are often prescribed just to calm down seniors, while possibly speeding up the decline they're meant to control. Number 9. Tricyclic antidepressants. Common medications in this group include amitriptyline, Elavil, nortriptyline, Pamelor, imipramine, Tofranil, doxepin, Silenior. For years before her diagnosis, 75-year-old Irene was prescribed amitriptyline for nerve pain. She was sharp, social, and loved crossword puzzles, until strange signs appeared. One day, she loaded her dishwasher with shoes. Another time, she whispered to her cat about who left the window talking. Her family brushed it off as medication side effects, but by the time the truth came out, Irene was deep in cognitive decline. She was diagnosed with dementia at 79. Tricyclic antidepressants block acetylcholine, a brain chemical vital for learning, focus, and short-term memory. Studies show these drugs increase dementia risk in long-term users, especially if combined with other brain-slowing meds. Despite the risks, they're still given for depression, insomnia, and chronic pain, especially in older adults. Sadly, many families only connect the dots after damage has already been done. Some medications truly help, but others quietly chip away at your memory long before symptoms appear. Most older adults never suspect them. That's why it's critical to ask your provider, is this still safe for my brain? Because once dementia takes root, turning back may no longer be an option. Thanks for tuning in. We'll see you there.